everybody. My name is Ghada Mohamed. I'm an assistant professor of neurology in the Division of Stroke and Cerebrovascular Disease at the Medical University of South Carolina. Let's get into stroke questions. So a stroke happens when a blood flow to the brain is blocked or the blood vessel in the brain bursts. This can cause damage or killing of part of the brain cell. It can lead to long-term disability, lasting brain damage, or even death. So there are two types of strokes. Ischemic stroke, which is a blockage of the blood vessels with a clot that can cause stopping of the blood flow into an area of the brain, causing damage. Sometimes this blockage is transient, fortunately, and that transient blockage does not cause permanent damage, which we call transient ischemic event or transient ischemic attack, TIA. However, it's a warning sign for increased risk for future stroke, so we want to address the TIA as aggressive just as the stroke. The other type of stroke is hemorrhagic stroke, which is a rupture in a blood vessel causing leakage of the blood into the brain, and that also can cause damage of the brain cells. When a patient having a stroke, they feel sudden neurological deficit, and it is characterized by sudden, like day and light, shift from 1 second when they were fine, and then the next thing they have a deficit. There is an acronym for the common symptom of stroke. It's B FAST. B stands for a balance problem. E stands for an eye problem, which is double vision, loss of vision, or blurry vision. F is a facial droop on one side. A is for arm or leg weakness. S for speech, which can be slurred speech or inability to speak correct words. These are among the most common symptoms. Other symptoms that can be witnessed by the family, which is sudden confusion or altered mental status, or even seizures for patients who are not known to have seizures or epilepsy. And the characteristic things of a stroke, it's sudden, like 1 minute the patient was normal and then the next minute there is clearly a neurological deficit. So healthy lifestyle is important for the brain and the heart health. So regular exercise, 30 minutes brisk walking at least 3 days a week is really healthy. Healthy diet, which is Mediterranean diet, more green, more fish, white meat in the meal more than red meat is really healthy. Obviously no smoking, limiting the alcohol drinking, and avoiding recreational drugs. And those for patients who have risk factors, it's really important to control these risk factors, like controlling of high blood pressure, diabetes, high cholesterol. For patients who have obstructive sleep apnea, it's really to address that problem because it can cause resistant hypertension. And for patients who have AFib, it's really important to stay compliant to the anticoagulation. That's a great question. High cholesterol is associated with increased risk for atherosclerosis, which is cholesterol built up in the wall of the blood vessel. This makes the blood vessel unhealthy, more liable for a blockage or forming a clot, which increases the risk of stroke. The association of lipoprotein A and increased risk of heart attack is very clear in literature. For the stroke risk, there are some studies that showed increased risk for stroke, and there are other studies did not show that link as strong. There are still studies and more research conducted to find direct and the clear association of lipoprotein A with the first stroke and stroke recurrence. Yes, absolutely. There is plenty of evidence that lowering cholesterol reduces the overall risk of first stroke, and we even want to be more aggressive with cholesterol management to prevent recurrent stroke, especially if the first stroke was related to atherosclerotic disease. Well, there is some data about the benefit of aspirin in primary stroke prevention in patients who have a high lipoprotein A detected. However, this is not heavily investigated and we don't really have a randomized clinical trial to support that yet. There is some evidence of the effect of aspirin in primary prevention in female patients at risk in general. The American College of Cardiology and American Heart Association recommended low dose aspirin might be considered for primary prevention for patients who have high risk of cardiovascular disease in adult between 40 and 70 years. But specifically for lipoprotein A increased level, we don't really have that robust data. Yeah, so it's important to follow up regularly with the primary care. Usually, the primary care will do regularly cholesterol panel to look at the overall cholesterol control and levels, blood pressure management, and addressing if the patient is have hypertension, hemoglobin A1C to detect if the patient really have diabetes or pre-diabetes. And overall, it's really needed to have healthy lifestyle, as we mentioned earlier, and control the risk factors if the primary care detect any to prevent any future cardiovascular diseases in general. Call 911 as soon as possible and tell them that you're suspecting a stroke. One of the things that you can do till the EMS arrive to check the blood sugar if there is a glucometer at home, because sometimes hypoglycemia, which is low sugar, can present with symptoms really similar to stroke and it's easy fix. But don't wait to call EMS. Call EMS as soon as possible, and then they will come evaluate the patient, determine what would be the best way to address. Thank you everyone for joining us today. My message will be make sure you don't neglect symptoms of stroke. Be fast, call 911 as soon as possible if you encounter stroke symptoms. Healthy lifestyle is the best way to prevent stroke.